Hello, I'm Sydney.
And I'm Rohita. And today we're here to discuss cats and how to maintain their overall health. From our understanding, cats don't visit the vet as often as needed.
Owners often assume cats are healthy and don't need annual veterinary visits due to their self-sufficient lifestyle and illness-hiding ability. While dog owners bring dogs to the vet annually because they are dependent on humans for everything.
To help us better understand this topic, we are here with Stephanie Frost and Dr. Kerry Arsenault from the Countryside Veterinary Hospital in Chelmsford, Massachusetts.
Welcome. Thank you for being on our show today.
Thank you.
Stephanie, tell us a little bit about yourself.
So I have been working at Countryside Veterinary Hospital since 2004. I have worked as a veterinary assistant, a dog trainer, various roles. I've been in veterinary medicine since about 1997. I attended the University of Massachusetts, Amherst, for animal science. And in addition, I just am also fear-free professional certified, as well as silver certified in low stress handling and restraint. And I am also a member of the Association of Professional Dog Trainers.
What about you, Dr. Arsenault?
So I've been at Countryside since 2006. I'm a general practitioner, so taking care of pets' basic overall health, but I also have a special interest in veterinary behavior, so I help to manage behavior issues between pets and their owners. I graduated from Tufts Veterinary School in 2006 and have been at Countryside ever since. And I also have been in the field for quite a long time. My first job ever at 14 years of age was as a kennel staff attendant in a veterinary hospital, and I kind of worked up through the ranks and never left the field. So
That's great. Dr. A, what do you most enjoy about your job?
So obviously you'll have to love animals to be in this field, and that's, playing with the puppies and kitten visits are a huge highlight to our day. But in addition to just the exposure to the animals, I really enjoy connecting with the families, and particularly with behavior problems. They tend to be a family problem. So I do enjoy the connections and being able to work with the family to work through some of those issues.
Stephanie, what do you most enjoy about your job?
Very similar, actually. So we've both worked at the same hospital for a long time, and you get to know the owners and their pets, and you get to care for the animals over their whole life, and you get to build a relationship with the people. And I think that's really rewarding. So I do like that.
Stephanie, what is it important that pet owners bring their pets to the vet?
I think a big thing is just how cats came to be with us. So people see them as more independent. The way they were domesticated didn't kind of match up with the way dogs came about. So we saw them a lot of time as, through the decades, they were just pest control, and they were kind of on their own, and they weren't pets in the same way that dogs were. So I think a lot of that just is in the mindset where we think, well, they don't need anything. They're also very stoic, and they don't tend to show their illnesses very well until they're really sick. So I think people just don't think of it.
Dr. Arsenault, why is it important to you that pet owners bring their pets to the vet?
Yes, a lot of what Stephanie just said, and in addition to that, it's, if you think of people, we go to the doctors not necessarily just when we're sick, but for just general health checkups, so to make sure that we're doing okay. There may be, depending on the stage of life, certain blood or other testing that could be helpful to make sure that, particularly for our animals that can't tell us when something is going on, especially if it's relatively early or minor, we kind of have to investigate those things and make sure that they are healthy, even if they're not showing obvious signs of ill health.
Dr. A, why is it that dogs visit the vet more than cats?
Yeah, it's a very difficult issue, and as Stephanie mentioned, not only is it harder just to tell that cats are having issues, but cats really don't enjoy going out of their own environment as much as many dogs do. So a lot of our dog patients are used to going in the car and going out for rides in the car and trips places, where most of our cats are staying by their own home and are more comfortable in their own environment. So when just the act of getting them somewhere is difficult. And then when they get to the veterinary hospital, it's a kind of a whole nother set of issues. So, you know.
So, Stephanie, what happens during a veterinary visit and why is it stressful for the cats?
So the first thing, as she mentioned, is getting them to the vet and getting them in a carrier and things like that. So they get to the vet, and generally we come in to a reception area, a lobby, and that can be hectic. That can be loud. There's dogs, there's other animals. Cats hear the noises. They get anxious and frightened. They are sensitive to smells. Things that we just use as cleaners and disinfectants, they smell much better than we do, stronger sense of smell. So that can overwhelm them. They can also pick up on pheromones from other cats. So when one cat goes to the vet, gets scared, and they release hormonal pheromones, and another cat comes in and picks those up and says, ooh, this is a place to be scared of already, right off the bat. So it kind of, then we get them in an exam room, and we have to take them out of that carrier where they generally just want to hide. And that's scary. We put them on a table, which is usually a little bit chilly because we want an easy to clean surface. We take them out and a stranger swoops in and hands are all over them. And I would imagine something that can't understand what we're doing, that would be a very overall scary experience.
So Dr. A, what are some common health problems you see in cats that don't visit the vet?
Yeah, so cats get a lot of the same problems as people do. I think some of the most common things that we see in our cat patients are things like obesity, dental disease. We see a lot of problems, particularly as they age, with kidney problems or thyroid problems. But everything from kind of simple medical problems that we can identify and intervene all the way to more serious problems, particularly as they age. But those are probably some of the more common ones that we identify.
So, Dr. A, how do you or a pet owner know when their cat is sick and what should they look for?
Yeah, there's a lot of different signs that we can look for, and as we already talked about, they're not always obvious. So there are the big signs like changes in eating or drinking, changes in their activity level, or very obvious signs like you or I might have, coughing or sneezing or vomiting or diarrhea. But for those of us that understand cat behavior or are interested in cat behavior, we also know about the more subtle signs. So a change in where a cat is sleeping, or a change in your cat's interaction with you, maybe a change in their litter box habits, not using it appropriately. Those can all be some of the more subtle signs that we might miss if we're not looking closely.
Where do you guys think that people can go to find a vet that's really good with cats and they can trust with their cat?
I think because cats are probably the second most after dogs common as far as vet visits go, most small animal veterinarians will treat cats. And then as far as finding one that's good with cats, you can look up things like the American Association of Feline Practitioners. They have a website. They have a search for practitioners that are members of that organization. And those members are ones who really take a strong interest in cat health, behavior, welfare. You can search for American Animal Hospital Association hospitals, and those are hospitals that have gone through loads of standards to be accredited for that. But I think a big thing boils down to is building a relationship with your vet. So sometimes a vet that is wonderful at practicing medicine, we just might not have the same rapport as with another vet who's also wonderful. So I do think you have to kind of build a relationship with your veterinarian and not be afraid to talk to them.
Stephanie, what tips do you recommend for new cat owners to make their veterinary visits less stressful?
I think it starts well before the vet visit. So I think a lot of people make the mistake of pulling out their cat carrier the day they have to go to the vet. And the cat runs and hides under the bed. So take out your carrier ahead of time. In an ideal world, your cat's carrier would just be part of their environment. So at a very minimum, take the carrier out at least a few days before the vet visit. Longer the better. make it a good place. Put something, a bed that they're comfortable with in the carrier. Leave the door open. You can just feed them right at the door to the crate, in the crate. You can toss treats in there randomly. That helps to get them a little more acclimated to it. When it comes time to bring them to the vet, you can purchase pheromone sprays, which are calming sprays. Remember, I mentioned cats can sense those pheromones. So these are pheromones that help the cat realize that everything's okay. It's calm, we're safe. And you can give a spritz inside the carrier. And that way the cat is used to the carrier. They'll go right in if you put some treats or food in. They'll have the calming spray. I do like to travel, ideally, with the carrier covered with a little bit of a towel, because it just helps cut down on some of those scary sights that cats can see when they're traveling. And if you have a cat that's really nervous, talk to your vet ahead of time. Find out if when you come in, so that we can not have that scary lobby. Call in advance and say, is there an open room we can go right into that's nice and quiet? If there's not, maybe even ask if you can wait in your car with the cat, where it's quieter, where there's not dogs barking, and say, can you call me when that room opens up, and we'll come in then. You can try yourself. It's very difficult. One thing, people that know their cats get nervous, they get nervous at the vet. And we feed off our pets, and our pets feed off us. And we go back and forth, and we get tense, and we worry about what the cat's going to do. You need to relax yourself as well at the vet. Take a deep breath. Your cat will be okay. You have to trust your veterinary team and know that they're professionals and they're going to handle your cat as well as they can to minimize their nervousness and stress.
So, where can we go for more information on cats?
Yeah, so Stephanie mentioned a couple of great organizations, the AAFP, American Association of Feline Practitioners, and the AAHA, American Animal Hospital Association, though they have great websites. There's also a few others that I like, petplace.com and veterinarypartner.com, and they've got some great overall information, not just on behavior, but on overall care of your cat and pets. And the reason I like those sites is they are overseen by veterinarians, so you know the information you're getting is accurate. There's obviously a lot of places to find information on the internet, but knowing that they're accurate is important.
Mm-hmm. I agree. I will also add, too, that the Fear Free program also has some resources for owners in helping getting your cat to the vet and acclimating them to their carrier and different things like that. And they also have a website generally called Fear Free Happy Homes. And so that's the owner-centric version of that website with additional tips and things like that for owners.
So thank you so much for being on our show today. We've truly learned a lot from you, and we'll take it into consideration when handling our cats, and hopefully our viewers will too.